This session will be moderated by Dr. T.S. Panwar. He is currently an air quality and climate advisor at CSTEP. He holds a PhD in air pollution modeling from IIT Delhi and has worked as Director of Climate Change and Energy at WWF India and as Director Energy Environment Policy at TERI, New Delhi. He was also an adjunct faculty and head for Center for Regulatory and Policy Research at TERI University, and his areas of interest include air quality, climate change, energy-environment linkage, low-carbon development, sustainability aspects, and environment management. And Dr. Panwar will now invite and introduce our speakers for this session. Please join me in welcoming Dr. Panwar to the stage.
Thanks, Nidhi, and very good afternoon to all of you. And thanks to CSTEP for this opportunity to have a discussion around this important theme of household air pollution, its impact and solutions. As you might have seen, the discussions during the last few days here have focused on outdoor or ambient air pollution. Though we have had some sort of interventions or discussions, especially during the plenary discussion morning session. And today also a few speakers touched upon the initiatives on household air pollution, and we also had a we heard the first-hand experience of Ms. Rama from Assar on this issue. But in this session, we have an opportunity to have an in-depth and dedicated discussion on this issue of household air pollution, its impacts and solutions. Let me start by putting forth some pointers on this theme. And those of you who have attended the earlier sessions, you might recollect that globally 2.3 billion people worldwide, that is 1/3 of the global population, cook using open fires or inefficient stoves fueled by solid fuels, which includes biomass and coal, and by kerosene. And since we have colleagues from the African continent, this is a massive problem across Africa as well as in India regarding household air pollution. In India itself, 36% of the population, that is roughly around 500 million people, use solid fuels and kerosene as primary cooking fuel. WHO has also estimated that household air pollution is responsible for 3.2 million premature deaths per annum in the year 2020, out of total of 6.7 million deaths, which include both outdoor and indoor air pollution. So roughly about half of the total premature deaths are due to household air pollution. Now, one thing which stands out prominent is that women and children bear a disproportionate amount of the health burden due to this source of pollution. And we saw in the session yesterday morning that children under the age of 5 are most impacted by it, and there is significant mortality because of the household pollution. In this field, as we know, awareness is a big issue, and majority of the population is unaware of the health impact or the dangers due to exposure to household air pollution, which in most Indian households is worse than the outdoor ambient levels which are there. So the pollution inside is sort of higher than what we have outside. And the indoor concentration of pollutants such as PM 2.5 can be easily one order higher than the outdoor air pollution. Now, the additional dimension in this is that pollutant inside has much more health impact because of two primary reasons. One is when you are inside in a closed environment, there is pollutant buildup. so that dispersal of pollutant is not there. And second is that the percentage of time which one spends inside is much more. So because of these two reasons, the problem gets much more aggravated. And as we have seen earlier, household air pollution is also a major contributor to ambient air pollution. We were just having a discussion. There are some studies which say that this contribution can go as high as, say, around 45% of the total PM 2.5 emissions which are there. The climate dimension, you are all aware, we had a discussion in the previous session regarding the black carbon emissions from inefficient cook stoves and the linkages to climate change on this. This problem has been there for a number of decades, and despite a number of initiatives taken over many decades, both in India and globally, we are in a situation that we are still grappling with this massive environmental health issue. So today we have an excellent panel of speakers to deliberate on the theme of household air pollution impacts and solutions. And two of the speakers would be joining us online. So before I invite the speakers, let me just go through briefly regarding their profiles. We have Dr. Abhishek Kar, who is Senior Program Lead at CEW. Abhishek was a postdoctoral research scientist at Columbia University before joining CEW in July 22. And prior to his PhD, he was a fellow at TERI. Abhishek's research has appeared in many in many journals, and also he has shared his findings on social media and newspaper articles. The other speaker we have is Mr. Dr. Roshan Vathor. He is a scientist in the Environmental Resource Planning and Management vertical at CSIR NIRI, and he has his BTech from IIT Madras, MTech from IIT Kanpur, and MS in Civil Engineering from North Carolina State University. He's worked on landmark cook stove intervention studies funded by US EPA and UNF GACC, now the Clean Cooking Alliance, in rural areas of Africa and India. His expertise includes cook stove performance evaluation in laboratory and real-world settings, climate and health implications, and cook stove design and optimization. The third speaker is Dr. Kalpana Balakrishnan. You have already heard her during the plenary yesterday, and she has a doctorate in biophysics and subsequent postdoctoral training in environmental health engineering from Johns Hopkins University. Her field of specialization include occupational and environmental health risk assessment, exposure assessment, industrial hygiene, and industrial toxicology. Currently, she is head of department environmental health engineering at Sri Ramachandra University, Chennai. And our fourth speaker in the panel is Dr. Ravindra Khaiwal. He is a distinguished figure in the field of environmental health and public policy. He is currently holding the position of Professor of Environmental Health at PGIMER Chandigarh, and he has an illustrious career spanning both academia and research. He has made significant contribution to understanding of environmental health risks, air pollution, and climate change adaptation strategies. So, as I mentioned, we have this excellent panel, and two of the speakers are here with us. May I invite Dr. Abhishek Kar and Dr. Roshan to come on the stage. And I hope our other two speakers on the panel have joined online. So welcome to Dr. Kalpana Balakrishnan and to Dr. Ravindra Khaiwal. Yeah. And I'm told by the organizers that we'll go in the reverse order. So we invite Dr. Ravindra Khaiwal to make his presentation. And before that, just a few points. As in the earlier sessions, we have a bell ringing at after 12 minutes, and then you have 2 to 3 minutes to wrap up your presentation. And questions, in the interest of time, will take after all the 4 presentations are made. So over to you, Professor Khaiwal. Thank you.
Thank you, Dr. Pawar. I hope I'm audible. And I regret that I could not join online because I'm in an ICAS meeting at Kyoto. When we talk about air pollution, next slide, please. So we, as highlighted by our panelists, we only talk about, you can say, high air pollution episode in North India and sometimes highly episodic issues in other part of India. Next slide, please. So when we talk about these issues, next slide, please. So you will see that this is where we are stuck, that, oh, outdoor air pollution, we talk about their sources also. But if you look at here, one source is also known as household combustion or fire. Next slide, please. And that is why we say that air pollution is not just this, but also including the indoor. Next. And when we talk about indoor, this is basically which is ignored. And now we also, we can say, divide indoor into indoor air quality and household air pollution, depending on the solid biomass fuel use. So next slide, please. So what we will see here, that various components, they play important role. Either it is household air pollution or either it is indoor air pollutant. And these characteristics are like occupant behavior, air exchange ratio, weather condition, and outdoor climate. So these factors will define how the air quality will be in indoor environment. Next slide, please. Think about now you have single dwelling and simply you are cooking with the solid biomass fuel. So that makes the situation even worse. Next slide, please. And we have now considered basically household air pollution as a different, you can say, category. Like I said, ambient air pollution, indoor air pollution, and then household air pollution, which basically define the uses of solid biomass fuel. And my panelist, or I can say the chair, was highlighting that how it is leading to the key, you can say, disease burden in developing nation because they need to work upon these issues. Next, please. So what are various pollutants? We know that it is mainly fine particle. The black carbon, which we were discussing, is also there. And toxic polycyclic aromatic hydrocarbon. And the vulnerable population, when we say children and women, they are affected the most. And it also contributes to the outdoor air pollution and also having climatic impact. So once we try to focus on household air pollution, we can also address outdoor air pollution and as well as climatic impact. Next, please. So looking at the Indian scenario, next slide, please. You will see that it is basically having more than 8 lakh premature deaths. So these are the preventable mortality which we could avoid. At the same time, the Delhi's means look at the economical burden of that would be very high. When you talk about the population, basically, we say, oh, it's mainly the, you can say, breathing difficulty or they have some problem in the eyes. But look at the disease burden. It is mainly the ischemic heart disease, stroke, and other disease. So only 25% burden is what population perceived. And we are having emerging evidence that not even a single disease, but many other diseases are also, means you can relate with it. Like our work from Punjab, we related it that how exposure to household air pollution could lead to cognitive defect. Basically, the IQ level could be 4 unit compromised. So think about that Einstein had a 140 IQ, and if you in general, basically, common man will have 4-digit compromise that will affect, and this is because of this CO exposure. Next slide, please. So that is why probably when we talk about total burden of air pollution, it is somewhere around 9 million death. Next slide. And when we will look at outdoor and indoor, and at the same time when you will combine, basically this become the number one cause. So we should not look only one perspective, it is outdoor, and we should look holistically. And next slide, please. So when next also, so when we say this, basically we need to understand that what is the community understanding or the rural population understanding may not reflect. Next slide. What is the disease burden? So the disease burden, if we look at, it is ischemic heart disease, stroke, and COPD. So apart from this, cancer and other risks are also there. So when we talk about this, are there enough evidences? Next slide, please. And then next. So you know that we have seen that there are no direct linkages. Yes, we can say basically what we are lacking is properly designed epidemiological studies, except a few Professor Balakrishnan and other colleagues are leading. But most of the association, you can say, they are association study, not causation studies. So in that term, I remember our colleague, next slide, please. When she was in AIMS, basically, she pioneered this. Next slide. She pioneered the work on chronic core pulmonary disease, which is found in heavy smoker. You know, it's like you can say they smoke heavily. And when she visited, she noted down that women, those who live in 1 or 2 room mudded huts, so basically they have this in young women. So thinking about, and since then we have cigarette packet where it is clearly written smoking kill, but household we are making progress, but not at the war scale as we need to do this. Next slide, please. We know that establishing these health effect and concern require a lot of effort because, next slide, because of exposure, and exposure when it become, basically you can say which organ will be affected and then what will be the end health outcome. So all these things basically make you can say health worse, which depend on nature of pollutant, concentration, duration. So all these factors are very important. Next slide, please. We also conducted a study in Punjab region where we use dust track and other indoor air quality monitoring you can say equipment. And what we noticed that you talk about, next slide, please, indoor air quality guideline as per WHO, they have to still revise. They have revised for outdoor, basically from 10 to 5 for annual, but they suggest 25 microgram. But we were having 25 microgram of black carbon in in indoor microenvironment. So this situation call for, you can say, action from health, from environment, and also exposure scientists, so that we minimize the burden of these women, those who are, I will say, normally from occupational point of view are exposed to this. Next slide, please. So this highlight, again, you will see that concentration reaching maximum of 24,000, you can say, for nanogram per meter cube for black carbon. But interesting part is that what we noticed that even having simple intervention like ventilation and other, they can reduce 40 to 60% of the pollution. So next slide, please. So there are certain, you can say, scheme which were taken by government, like Prime Minister Ujjwala Yojana, Give It Up, Pehel, and at the same time, we advise the community means what they can do, like cooking in a well-ventilated area, avoiding cooking with wet fuel, or you can say basically when you cook, basically you can cook for 2 times or something like that. So these options are there, but still we are seeing the impact is increasing. If we talk about these policies, next slide, please. They are over a period of time, means from, if you look at national program on improved chula to till date PMUY, basically these actions are there, but are we getting the transition towards clean fuel? That remain a challenge, and specifically when COVID was there, this transition was affected. So we need to think about that after the COVID, how we do a better recovery towards the transition of the clean fuel. Next slide, please. So for that, basically, we said that yes, there are certain achievement like you have self-help group, financial offer, PM Garib Kalyan Yojana, and as well as at that time there were some subsidy and other benefit. So you looking at this basically low and key situation, basically we have prospects for you can say cleaning our household air pollution. So if we look at the impact point of view, over 80 million households have obtained access to LPG, and there are also state level initiative like Himachal Granny Suvidha Yojana, and Himachal was also pioneer in promoting e-cooking. So probably if that can be achieved, that would be also you can say means this is what we say is the future from gases to electricity basically. Other could be like issues if we talk about, or challenges in transitions are fuel stacking, affordability, supply chain and distribution challenges. Next slide, please. So when we say these challenges, we also try to understand various other issues in Punjab region, where we try to look at the cooking fuel and respiratory symptoms in non-TB, non-smoking women, and what we, next slide please, observed. These are the very good agreement showing for three states, basically Uttar Pradesh, Punjab, and Haryana. Next, please. And what we observed that first, those who are poor, they are paying the price. Second, those who are from marginalized community, means scheduled caste, scheduled tribe, they are having high odd ratio, and those who are, you can say, having poor education. So basically, first, you are marginalized. Second, you are affected by household pollution. So basically, this poverty vicious cycle and you can say social distribution is a major restrictions basically in transition. So we need to address this, and we need to for our marginalized population if we want to look for sustainable solution. Next slide, please. So what we can say in this way, basically, they are individual barrier. As you can see, some of them are like taste preferences. In Punjab region, I know that we like chule ki roti or tandoori naan, and I am sure when you visit us, you also like that. Then physical environmental barrier. In that term, basically, they use biomass also not only for cooking but heating purpose. Then community barrier, then socio-economical barrier, then LPG, you can say supply chain issue, behavioral factor. So all these issues basically are there, but we will deliberate upon this, having localized community-based solution, and that we hope we can achieve. So next slide, please. And considering this, basically, these transitions become very important. So we, in one of our study, have proposed that how these social, personal, and structural constraint could be addressed through various approaches, as I have written here, and these barrier towards fuel transition could be achieved so that we have a clean air and better health for all population. Next slide, please. Then we also have this one of our study where we identify the major, you can say, gap area where we need to work, and we propose this Kheval model published in Science of the Total Environment. So we need to focus on knowledge transfer, basically housing, awareness, intervention, willingness to pay, adoption, and low emissions. Like you were talking about uh, basically clean chula, or like we have developed a smokeless chula. So we need to focus on these barrier, looking at holistically, which combine social, technological, and policy element, and addressing the multiple aspect of clean fuel transition. So we need to also be prepared for like we have seen, there was a COVID and there was, you can say, kind of a breakage to this transition. So such thing, if ever happen in near future, how quickly we address that? Because once you transit, next slide, please. So you minimize that. Next slide, please. I have briefly discussed this. So we have also shown that what are the various benefits. Next slide, please. And in this, basically, if we talk about how we can achieve this, so key important aspect we have listed, like pricing and subsidy approach, supply chain optimization, community engagement, awareness and education, economical support, and monitoring and feedback. Basically, we can see that like there are people will say within 24 hours you will get your supply, but if they don't get it, they will immediately switch to other availability of the fuel, basically. So we need to integrate policy, and nowadays we talk about IT and other sector, basically, that need to be also reach or percolate to the rural population, so that true benefit could go top down. Next slide, please. And of course, private sector remain the you can say major role, because addressing through social corporate responsibility, they can go there. At the same time, the local governments can play a major role, like Panchayati Raj system, so that they involve their staff, employee for this clean fuel initiative and ensure that every household has a clean fuel availability. Last mile connectivity, and at the same time, like we have monitoring and feedback for our systems in education and other, we need to have this for the supply chain model of clean fuel. Next slide. Here we are highlighting some of our work, which shows that how we can achieve the successful transition to clean fuel. Next slide, please. Or what are the various health impact. And if we focus on these intervention, next slide, please, these intervention can work. And the recent study from Lancet Planetary Health has shown that if we focus on intervention like in LPG through PMUY, we can have the positive result. Next, please. So these positive results, if I look at in terms of challenge and research gap, we need to identify that where we can put like low-hanging fruit, and where we have basically long-term goal, we need to address that. So these are the issues and challenges we address, and we can focus on low-hanging and then targeting in near future, so that not only we achieve this clean fuel, but sustainable development goal. Next, please. And this can be achieved basically, as I also discussed, policy focusing on marginalized population. So by ensuring sustainable uptake and transition without any gap, either it's COVID or either their financial region. And we need to create reward mechanism, those who continuously use clean fuel. So if any policy can come up, that will be a great benefit. And at the same time, the financial innovations basically, so that kind of a subsidy, like we have direct beneficiary, but at the same time, kind of a flexible approach to this subsidy. So if you look at this image, basically, we have to focus on somewhere this transition from solid biomass fuel to clean gases and then electricity, because that is where we see the future of clean India. Next slide, please. And as I said, this will be the goal for having by 2030 or in near future achieve these SDG. Because SDG, if I talk about providing clean fuel, could be related to any of the goal. Next, please. In this also, while I was talking about science, basically we have also worked upon several ICs. So this is the booklet we developed, basically how you can minimize the personal exposure at household level in various microenvironment. So very simple, you can say, steps has been proposed, and we are integrating and using these material to train our community through or ASA worker basically, or other basically, you can say like A&M, even the teachers, and they are becoming part of this our movement to educate community. Next, please. And other is that we are trying to have this health adaptation plan was developed and adopted by Government of India by PGMER, and I was the key in that. And now we are having data, so we could also from rural and as well as urban center, so that data can in near future help us to better link the air pollution exposure with health outcome. Next.
Professor
And
Keval, can we please wrap up now?
yeah, it's done almost. So next is like this health basically handbook, sensitizing the medical professional. Next, please. Or basically health sector preparedness for, you can say, when there is a high air pollution episode, like you saw in Delhi, there was a school shut down and the air pollution level at a severity level. Next, please. And making community aware. So here you will see one chapter dedicated to basically on household air pollution and how various you can say actor or stakeholder can play their role. Next, please. Yeah. So basically, we are also linking that if you work for air pollution, you can not only address the basically air pollution in term, but you can also have climatic benefit. So basically, when we talk about
So,
climate change, we need to understand that addressing air pollution, we will gain basically in this term economically and as well as in term of sustainability. So with this, basically, I end my talk, and we all can take some individual step to educate our rural community, and we can minimize our emissions also. Thank you.
so thanks, Professor Keval. I think it was a very comprehensive overview which you gave, but something stood out very clearly. One is your focus on interventions and to increase the uptake of clean fuels, and especially what you termed as Keval model, which combines social, technological, and policy elements. It was heartening to know that your slides mentioned that the interventions are working, and that's a positive step. And also the sort of rich list of resource material and guides which are available, they can be very significant and can help in increasing the awareness on this issue. So now with this presentation, let me move to our next online speaker, which is Professor Kalpana Balakrishnan. So Professor Balakrishnan, please take over.
Thank you again, Dr. Panwar, Abhishek, and all the other colleagues who are there for this session. And thank you once again, Dr. Suru, for this opportunity to present yet again at the CSTEP conclave. So today I'll try and use materials that I didn't get a chance to really talk about yesterday. I think many of you were there at the plenary yesterday, heard my pitch on why we think household air pollution, as Dr. Kaiwal also noted, might be the lowest hanging fruit for us to invest in terms of household air pollution actions. And just a reminder that this is a setting that we are talking about intervening. So I hope that we will all collectively try to shed some light on how we might want to move forward. The first most important thing that we, I think, need to come on the same page based on recent evidence is that we now know as much about health effects and quantitative exposure response information for household air pollution as we do for ambient air pollution in our exposure settings. It's not as though the evidence for ambient air pollution is somehow stronger, or that the evidence on health effects of household air pollution is somewhat lagging behind, especially in terms of quantitative exposure response information. So I'll try to provide a very brief overview on what we are, where we are with respect to our understanding of what is the consolidated evidence on health effects from household air pollution, and what is the evidence for health effects that are associated with the transition to LPG. That brings the question is, yes, health may be one of the drivers for intervention, but what else do we know about the household air pollution intervention that we are proposing, especially in terms of cleaner energy, LPG in this case, to initiate action, and where are our gaps in our mindset that we currently are having to deal with? I do want to belabor this point a little bit because up until recently, we knew a great deal about the health effects of household air pollution. Dr. will recall our early days, we didn't have quite enough measurements of household air pollution because we couldn't monitor all the complex cocktails that are emitted, and lack of measurements essentially necessitated the use of secondary indicators like the type of primary fuel or the type of cook stove as the surrogate indicator for a quantitative measure of PM 2.5 or black carbon or carbon monoxide. But it's now very important to recognize that we actually have data on quantitative measures of pretty much every single one of these pollutants, and in some cases large national data sets, in some cases a relatively small study data sets. And what we are now able to measure in rural households lends itself very nicely to modeling efforts, because we have the whole tiers of measurements, from household level microenvironmental measurements to personal exposure measurements, ambient measurements, to biomarkers, to surveys. So the entire integration across tiers that are necessary for models is now possible. And we are not just able to do short-term monitoring, but because some of these devices, many of you may have seen some of these earliest pictures. I'm sure Dr. Panwar, you remember, Kurt Smith used to show these pictures often in terms of the first Gujarati woman, Diwali Ben, who got her measurements done in 1981 for personal exposures. But now we have wearables that can measure in real time with GPS devices. And so it's a whole different ballgame now in terms of what we're able to measure for very vulnerable populations in very resource-constrained settings. That's an important point to remember in terms of progress. So we are collecting data of very high quality. And the second thing to also remember is that how exposures, so when we talk about household air pollution, it is always pitched as an indoor air pollution issue. And this needs to be really reframed. Household air pollution produces pollution. Household air pollution as a risk factor is defined as pollution associated with the use of solid or other low energy cooked fuels. And therefore, this pollution not only happens inside the home, but also outside the home. And that is part of the reason why exposures to ambient and household air pollution coexist. Not only inside the home in the case of rural households, but both inside and outside the homes in the case of rural households, and contributions to ambient and urban environments as well. Because of the large volume of measurements that has been possible now, it's very important to recognize that when we are looking at integrated exposure response functions of the kind that is done in GPD, when these quantitative measures of pollution overlap, then evidence becomes transportable across settings with the assumption that these particles are of course equally toxic. There may be some limitations to that, but we currently do not have evidence that PM 2.5 from different sources are distinctly different in terms of the type of health effects. The strength of association may be slightly different, but we certainly think that now we know that ambient and household exposure ranges overlap as far as PM 2.5 is concerned, and therefore a lot of the evidence that is generated for ambient air pollution becomes suddenly very relevant for the household air pollution settings, and vice versa, because we have evidence from the same products of incomplete combustion being indicated by PM 2.5 as an indicator pollutant being used as an exposure metric. You will be also happy to know, in case you already are not familiar with this literature, that unlike ambient air pollution, in household air pollution, because it's a household level intervention, there have been multiple trials, randomized controlled trials that have been mounted using various fuel and stove technologies. Some are clean fuels, such as LPG, but there have been many trials of improved cook stoves that have relied on solid cook fuels with various kinds of technologies. And so HAP, or household air pollution, has a combination of RCTs and observational studies, as well as the GBD, integrated exposure response modeling, to inform us about the range of health effects. So you can see every single life course health impact you can think of is included in this evidence pool. And here, I am, the organizers presumably will share the slides. And so I just put together a list of all the major trials that are that have been mounted. The advantage of some of these trials have been that regardless of what the intention to treat analysis results was, they also collected individual level longitudinal exposure information, and therefore all these outcomes that are listed there ended up having exposure response relationships. So even if that technology fails, if another technology is able to reduce the exposures further over a longer period of time, you can at least expect that the health benefits will be there. Even if the differences between the intervention and the control arm were insignificant because of factors that we could not match at baseline. And here are just very quick illustrations of the types of exposure response information that are available from household air pollution, from Guatemala, from Ghana for pneumonia, from Tamil Nadu for birth weight, from Ghana for birth weight, from the GRAFS trial, the results that I showed yesterday, results for birth weight from Ghana, Peru, Rwanda, and Guatemala as part of the HAPPEN trial, all of which are indicating a significant association of these outcomes with reduced exposures. Very strong evidence, therefore. And another multi-country effort, Dr. Subbu was mentioning yesterday about how evidence is now becoming not only available from India, but India participating in these multi-country studies and for household air pollution. So this is quite significant, improvement over the past years when we didn't have evidence of this kind. So Pure Air was again a multi-country study, as you can see, across multiple household air pollution exposure using settings, and it published the results on cardiovascular mortality. It's very similar to the TPD efforts across all these settings. And this is my last slide on the health effects of household air pollution, where you can sort of really look at the most recent meta-analysis for household air pollution associated outcomes when compared to LPG use. So all those studies that had primary LPG use, how did they compare with households that used biomass with respect to all these outcomes? And as you can all see, majority or virtually all of the outcomes, the central estimate is favoring LPG. So there is very convincing evidence that the use of LPG, A, reduces exposures, B, is associated with improved health outcomes, even if the most recently conducted LPG trial, the HAPPEN trial, produced negative results as far as the intention to treat analysis was concerned. So where do we think are the critical gaps for action here? We do have a very thorough analysis of the issue, somewhat dated now. Perhaps it's time for revisiting the WHO air quality guidelines for household fuel combustion. That was done in 2014 with the collaboration of many of the colleagues here in the room as well. I want to dwell on 3 points, 2 of which were also mentioned last year. I think we should sort of really take cognizance of the fact that if we pitch household air pollution as an issue as a health issue for the rural poor, then our ability to act in the near term is going to be very much difficult because there are multiple competing health priorities for the rural populations that for which money is going to be not possible to reallocate. So it can't be just a health issue. Health is one of the drivers, but it has to be pitched as a driver that is having co-benefits for multiple other things while providing the health benefits to the most vulnerable populations and providing energy equity. The first is that the ambient concentrations could set the floor for this discussion. Nearly 22 to 52% of the Indian and ambient air pollution is now attributable to the residential sector. Different studies have estimated the range is anywhere between 20 to 50%. So a significant part of India's ambient air pollution has to be, accorded to household sector, and we are not going to be in attainment, as I mentioned yesterday, for 90% of the India's population if we are not going to be in a position to eliminate solid fuels. And this is just a study that I didn't get a chance to explain yesterday from Sagnik Day and his group. Which essentially illustrates that if you were to transition entirely to solid fuel free situations in the country, then we would have nearly 85% of the districts in compliance with the national ambient air quality standards. And now with the advent of low-cost sensors, the key question is, even if we were to begin some of these monitoring exercises across in rural households, rural communities, how would we do? We already have there Josh sharing many lessons from the Samosa project from rural areas as well. And now we have the Arm Lassi project also funded by the NIH ISN in South India, where we are getting results of the low-cost sensors, reliable information on looking at trends in ambient air quality in relation to PMUY related, use. So villages that have high level of PMUY, not only PMUY, connections, but also high levels of PMUY household use compared to ones that have low levels of use to sort of really serve as a long-term indicator. Most importantly, these slides I shared yesterday for what the HAPPEN trial provided us as information. When we provided LPG for a period of 18 months across 4 countries, entirely free, so that the households, the women in these households in the intervention arm were able to use it for the duration of the trial. Much to our surprise, we found that without virtually no reinforcement, no behavioral urging, nudging, all women in, except for Peru, where we had some mixed, results. In India, we had virtually 99% LPG used during the intervention period. The households were, of course, free to sell their cylinders, just transmission to biomass fuels in between. And the control arm, whom we gave the LPG for 18 months, at the end of the trial, to adhere to using biomass use for an entire 18-month period. They're telling us a very important lesson. We also have results published from the behavioral and the focus group discussions. The barrier is pure and solid economic. Everything else can be overcome, at least for 90 or 95% of the population, if they, if we can actually do that. And when households do,
sorry to intervene. You have 2 minutes to wrap up.
All right, great. So we, and when people use LPG, as you can see, the red line is the intervention arm and the blue line is the control arm. For a duration of 18-month period, we were actually able to document that the levels, even with a household level intervention in a biomass using village, the personal exposures for women and pregnant women and older adult women still ended up being under the WHO interim target guidelines that to date, no other action has been able to achieve and sustain over a year long or that substitution of the biomass fuel with LPG results in an exposure reduction. Clearly, ITGs are health relevant exposure reductions. Many of the improved biomass foodstuffs did provide reductions of up to 70%, 80%, 90% reduction in emissions, and even reductions baseline, but they were not health relevant exposure reductions because they did not get it down to any of the WHO interim target guidelines. And again, a slide that I showed you yesterday in terms of we still don't understand the co-benefits fully. So if ambient air pollution argument is not enough, LPG producing an exposure reduction below the interim target guideline is not enough. The health inequity argument is still incomplete. We don't even have enough data to look at what the time poverty benefits would be for women when they transition to LPG. And of course, as Dr. Kaiwal was also alluding, here is an example of multiple cookstove and fuel technologies compared for both health and climate purposes. So my submission to this August audience is that if we can sort of really look at HAP mitigation via LPG at scale, this is perhaps the best possible way for India to be on the path towards meeting ambient air quality guidelines through an existing government program that is already halfway completed. The access part to PMUI is already completed. All we have to do is find the money through whatever means that our best brains in economics can put together. And I can't think of a better case for getting the benefits to the most vulnerable amongst us. I will conclude by asking ourselves, do we know enough to act? We probably will want more to act, but most importantly, what arguments do we have against clean energy for low and middle income country households? Do we have any arguments that we should act? We all agree that we should act. We may not have the money to act. So I think it's a question of finding the money rather than arguing about whether or not or when we should act. Thank you very much. I'll stop here.
Thanks. Thanks, Kalpana. As usual, a very informative and thought-provoking presentation, and especially not only on the scientific aspects you touched, but also as a solution, LPG at scale and the economic issues associated with it. So may I now call upon Dr. Roshan Wator to make his presentation. And Roshan, you will be able to hear the bell after 12 minutes.
Yeah, a very good afternoon and thank you for inviting me to this talk. So I'll be discussing mostly on cook stoves and how do you test cook stoves in the field. This has not been discussed yet, so something new and something different in this presentation. So basically, actually Kalpana madam has already covered most of my stuff. So we know that these emissions from solid fuel combustion leads to several emissions as well as GHG emissions. Mostly these are carbonaceous aerosols. The most important one being black carbon, which has a significant impact on the climate as well as health. So there are some estimates which say that black carbon, is the household air pollution is the highest contributor to black carbon in anthropogenic black carbon mostly. And clean cooking, why does it matter? Because it also significantly contributes to several SDG goals as well. So, and India is one of the most India has the largest population, which is starved of clean cooking. So we have the largest population without access to clean cooking as well. And PMUI was there, which has done a pretty good job in providing access, but then that has obviously not translated into exclusive use of LPG. And this will be discussed further by Abhishek as well, but there have been several reports which pretty much confirms that affordability is one of the major challenges for complete and exclusive use of LPG and adoption of LPG. We work in the villages or these field sites, which we work in India, mostly it's rural Maharashtra and rural Madhya Pradesh. We still see that people are dependent on solid fuel use and their traditional base cook stoves. These cook stoves are mostly clay-based or concrete-based cook stoves, and you can see in the pictures that these are how they look. So now we'll come to the we'll see that how do you actually test a cook stove in the lab. So a typical cook stove testing lab would look something like this. We have a total capture hood right here to capture complete emissions. And then we have a dilution tunnel here. We have a fixed cooking task, which is boiling water. And then we have our instruments at the end, the ACSM and the other instruments where we used to measure the characterization of the emissions. So these tests actually focus on repeatability and to facilitate comparison between different cook stove models, so you know which models performs good or bad. But then, and there are several testing protocols which all involve boiling water in the lab, but in the field it involves cooking of actual food as well. The latest ones are the ISO testing protocols, which have been, which are the latest protocols basically. So this slide was just shared by Kalpana madam just previously. I'll just quickly deep dive into it. So this is essentially health and climate impacts of LPG. At the x-axis, you have the PM intake in the log scale, and at the y-axis, you have the global warming commitment or the global warming potential, which is in tons of CO2 equivalents. And at the top here, you have your traditional stoves, which have the highest health and climate impacts. And then as you keep on improving cook stove technology, you start getting some benefits in both health and climate. And at the end, you see LPG right there, which has the least impacts on health and climate. These are in-use emissions. This does not account for life cycle emissions of LPG. So keep in mind that these are lab-based studies. This is what you get if you translate your lab studies to this field. So, but when you go to the field, so there is a lot of things going on. There is so much variability. So you don't have the typical setup which you have in the lab in the field, which is in the field. So you would typically have in the field something like a plume averaging probe. Then you would have a portable emission sampling instrument, and and then we essentially capture real-world emissions with these cook stoves. And along with that, there are several assumptions of carbon balance as well. And you use these measurements to get emission factors in grams of pollutant per the kilogram of dry wood consumed. And these are essentially inputs which goes into the climate models, as well as this is how you determine the climate impacts of these stoves. So, and also you can do emission rates. So this was a study in Malawi, which I was there, and we looked into, so this is what it would typically look like in African countries. So you have, it's not visible here, but there is a child behind. You can see his leg there. And so the practice there was if it's an infant child, then they would cook with the child as well. So when previous studies of lab and field comparisons show that field results actually, or field emission factors exceed the lab emission factors by nearly 2 to 5 times. And what this means is that the benefits which you would expect from a cook stove, you don't actually, in reality, you actually don't get benefits of these cook stoves when you operate them in the field. So now we'll look into the real-world performance of forced draft cook stoves. So why am I saying FD stoves? So forced draft cook stoves are regarded as the best performing biomass burning cook stoves. And in terms of both efficiency as well as emission factors. So so I was part of a study in Malawi as well, where we compared various cook stove models, which include the traditional cook stove. We have a clay-based improved cook stove model, as well as the forced draft cook stove, which is the Philips right there. And this was the first study to evaluate the real-world performance of these stoves, and we find a very similar story that you have your lab emissions. So this is the Philips, the green one. We have the lab-based emission factors right here, and then you have the field-based emission factors, which obviously are which are higher. And in terms of black carbon as well, these improved cook stoves have a higher emission factor for black carbon, but this is compensated by the reduced fuel use as well as cooking times. So you actually have lower emission rates of black carbon. If you look into the climate impacts of these cook stoves, the black one is the black carbon there, and it contributes significantly as well to the total global warming. You have some negative due to the organic carbon as well. So now we come back to this graph again, and what we see here is that your Phillips is right here, whereas the lab Phillips would be here, but the field Phillips is pretty much what is in line with an improved natural draft cook stove in the lab. So, and this slide was again just shown in the previous talk as well. So this right here point is a pellet fed forced draft stove. So when you change so a biomass fed FD stove will perform very similarly to a rocket stove in the lab, but once you change the fuel from biomass to pellet, you actually approach LPG-like performance in the field, which was something new which we found. And so basically it is not the stove itself, but the stove fuel combination which influences these health and climate impacts. And another interesting thing which we noted that the clay-based stove, which obviously was not the best performing stove, but since it resembled their traditional cooking so much, it was like more accepted in the communities. Now we look into real world performance of LPG stoves. So this was an EPA funded project in 2 states in India. And very interestingly, we did this in Himachal and Karnataka. So in Karnataka, there were several households which had an inbuilt chimney right here. It is still a traditional stove, but they have a chimney right here. And these chimneys were built during the time of construction of household, which was very unique. And in Kullu, these tandoors are pretty popular and they have their own ventilation as well. So when we looked into the performance of LPG, again, a very similar story. We have lab-based results right here, and then the field results are all over the place, and then because of many other influenced events as well. And similar story for carbon monoxide as well. And if we segregate the LPG emissions to oil and without oil, we see that what food is being cooked, that is also influencing the overall performance or the overall emission factors of these stoves. These are mostly accounted for emissions from cooking. And this was again published as well. So in the same study, we also looked into 24-hour microenvironment concentrations, which was measured with the micropem. And so these are the 2 locations right here. The most important thing in this slide is, this last bar chart, which you see, it is exclusive LPG use right here and in here as well. So it is only exclusive LPG use, which is actually we are able to touch the WHO IT1. Ventilation also does play a huge effect, wherein we see significant reductions, more than 50%, I think. And but then it is only LPG use, which exclusive LPG use, not even primary LPG use is not enough to reach the WHO IT1, but it is only exclusive LPG use. So we do see that LPG does have the potential to provide significant health benefits as well. So now the question of climate impacts. This is a work which I've been doing with Abhishek as well and others at the CEW. I think there was a question yesterday as well on what are the climate impacts of LPG. So before we start, I'll just introduce the concept of fraction of non-renewable biomass, so or FNRB as we call it. So it is essentially an important metric, and these goes into carbon finance and carbon credit calculations. And FNRB indicates that how much of the wood is being renewably or non-renewably harvested. For example, if the FNRB is 30% or 0.3, it means that 30% of the CO2 released into the atmosphere due to biomass burning is not reverted back into woody biomass, and hence it contributes to net warming as well. So if you have a higher FNRB, the more warming you are, it is associated with a higher warming potential, and a lower FNRB means that you are harvesting your biomass renewably, so it leads to a less climate impact because the emissions, because it's emitted, whatever CO2 is emitted comes back into the woody form. And FNRB for India is around 24%. It does have regional variation, but the average is around 24%. So what we did was we looked into the life cycle emissions of LPG using the GREAT model, which accounts for extraction, processing, transport, as well as end-use emissions. And we compared them with traditionally burnt biomass with end-use emissions only, because we did not consider that, we assume that the biomass, there is no climate impacts associated with the collection of biomass. So we did this exercise with both GHGs as well as GHGPs and short-lived climate pollutants. So we found that if FNRP is greater than 11%, there is a net climate effect of LPG is lower than what we find with firewood. But if you include SLCPs, it's LPG has a significantly less climate impact than at all FNRPs. So this solid line right here is the firewood emission factors, and the dotted lines are GHGs plus SLCP. So this is only GHG and this is only GHG plus SLCPs. Inclusion of SLCPs in the LPG, we hardly find that it's almost the same. We don't find any difference. So we do find that if the biomass is unsustainably harvested, there is an indication that LPG would be able to provide climate impacts and hence carbon finance. So we published this policy brief last year, and Abhishek will be delving more into this. So, but basically what we proposed was that LPG can be used as a candidate for carbon finance in the global south as well. We also did a short extension of this study, wherein we looked into state-wise how much carbon credits could be generated and how much subsidy can we get based on very, very conservative assumptions of carbon finance mechanisms. And the number is somewhere, say, if you just include GHGs, it's around 600 crores, but if you include SLCPs, it's like 7 times higher actually. And that roughly translates to around rupees 150 per cylinder. This was also covered in Times of India. We at NIRI also have a cookstove testing lab in India. At the time, this was the only functional testing lab in India. And we also, this was set up with the help of IIT Bombay. In NIRI itself, we have our own cookstove as well, which has been used as part of carbon finance programs, and we have done several lab and field evaluations as well as IEC activities, demonstrations of NIRUs. This is a low-cost cookstove, so we are actually working with Glenmark Foundation, and they wanted a cookstove which was adoptable and not metal, and they wanted lower-cost cookstoves, something made of mud and concretes, which can be used. So we designed these cookstoves based on several lab experiments, and we also did field evaluation of these cookstoves. And very interestingly, these are some pictures right there. We found that these stoves pretty much, so an optimized and optimally designed mud or concrete-based cookstove can actually perform similar to a metal-based cookstove in the field. But at the same time, it is more adoptable and it is also very much cheaper. So these cookstoves will cost somewhere between 300 to 500 rupees. And this was also published, and this is actually the first study to incorporate the new ISO field testing protocol as well. We also do several IC activities as well. So this is the last slide, which essentially summarizes the work which we have been doing. So we do know that solid fuel will still prevail, and there is still dependence of solid fuel, especially in rural India, and there is a significant performance discrepancy in lab and field performance of these cookstoves. So a biomass-based wood-burning forced draft cookstove would perform similar to a natural draft cookstove in the lab. But then if you change the fuel to pellets, you actually approach LPG like, performance very close to LPG. It's a much cleaner fuel. LPG emissions are higher in the field due to influence of other sources and type of the food which is cooked. Ventilation is a very important factor which is often overlooked as well. And proper ventilation can also significantly reduce exposures as well. And then finally, carbon finance for LPG from PMUI. We are working with CEW to address these challenges. Thank you.
Thanks, Roshan, for highlighting the science behind the various technological interventions which are possible, but also regarding the carbon potential, especially for the LPG interventions. So thanks very much, and we are running behind schedule, but we will have our last speaker for this session, Dr. Abhishek Kar. Thank you.
Thank you, everyone. The last, but hopefully not the least. So, I am from CEW. So, we are a 13-year-old, non-partisan, independent policy research institution based out of Delhi. And our motto is to use data, integrated analysis, and strategic outreach to explain and change the use, reuse, and misuse of resources. We work on several verticals. In the interest of time, I'll just move on to the topic. And thankfully, because the previous speakers have already spoken eloquently on the problem, I'll really not go into the problem, but focus more on the solution part of it. We have a lot of options, but I think several studies and generally the consensus has been that it's important that we understand that LPG, though it's a fossil fuel, it is a transition technology, at least in the interim next 10 to 30 years, for most, not just India, but across the global south. And we also believe that given the market conditions and dynamics, it is also the most scalable out of the various options that are there currently. And this is called the bleens, the cleanest fuels in some ways. Now, before I move to the word transition, I think it's very important to pause a little and think about it, that it is not like a on-off switch. Okay, today you're using a traditional stove and tomorrow a LPG stove comes and you just switch 100%. It doesn't happen. And that's why way before, since the 1980s and 90s, a word has been used called stacking, which is basically you use multiple technologies. And if you look about our own homes, we do have multiple cooking energy technologies, from microwave oven to LPG to induction stoves maybe. And the way I have looked in my last 7-8 years of work, both my doctoral work and my postdoctoral work, I tried to do deeper dive into how this transition happens. And I kind of broke it down into 4 stages of transition. And of course, people are most welcome to refute it, push back on whether these are the right ways of stages. But there has been one of the very dominant theories in social psychology called the trans-theoretical model of change, where they look into several behaviors and they have found that if you do targeted measures for someone who is at a specific stage in the transition journey, the outcome is going to be more effective. Now, this has unfortunately never been tested at a scale in this space of clean cooking. However, based on 2 different studies, one in India, one in Ghana, I think there is some serious evidence at this point which makes a case that it's worth exploring and going on this path further. The first stage, it starts with people who are not using LPG. Now, it does not mean they do not have LPG. They may have LPG very well, but they're not using LPG. The next stage is where they're using LPG as a non-primary fuel, which can be a secondary fuel, a tertiary fuel. But again, depending, there are a range of estimates, but based on our past work, we kind of put a thumb rule for a typical family of 5 in a rural India. And these numbers can slightly change from country to country. About 1 to 3 cylinders, big cylinders, the 14.2 kg cylinders, you can think of those as non-primary LPG use in a year. If someone purchases 1 to 3 cylinders, if someone purchases 4 and above, we can assume that they are using LPG as their primary cooking fuel or the main cooking fuel. And interestingly, this is the only statistics that is reliably captured in several surveys. Most of the surveys around cooking energy access, the questions around is what is your primary cooking fuel or what is your main cooking fuel? And this is one indicator that is reliably captured around the world, that what is the primary cooking fuel. And that's why 4 and above we kind of think of as primary. 8 and above is something that you can think of as the nirvana, the ideal, the exclusive LPG use. That is something I think most people in this community would love to kind of see happen over the years. But as the optimist, but also the realist in some ways, I'll say it can be a great start if you think of just like in air pollution, we have the idea of interim and the final target. The interim target in this space should be that people transition to primary use of LPG. And why is that? I think I just want to go a little deeper into this. Recently, we did a study, and this I did when I was at Columbia University, and we did it with Kindampo Health Research Center in Ghana, and we did a national survey of almost 7,000 households, and we looked into households who were at various stages of transition. And what we found was the demographics that is most likely to transition from primary LPG use to exclusive LPG use is not really the demography that is there, what we expect. We would need a male primary cook, we would need a female household head, and we will need a highly educated household. Now this trifecta of conditions, you may not even find in 2% or 3% of the entire country's target households. So given that, it is extremely difficult to transition people from primary to exclusive, given the structural factors in place. It is useful to start and think of some realistic targets, such as let's move everyone to primary use of clean cooking fuels, and given the discussion around scalability, perhaps target LPG. And as someone who has done his doctoral thesis in behavior change, I 100% agree with my previous speaker, Dr. Kalpana Balakrishnan, that behavior change in many ways is a conditional factor. If you give it free of cost, all the challenges of culture, taste doesn't come in. But the moment it's about paying money, the gender dynamics kind of comes into play, and then people are going to come up and say, okay, is it a value for money? It doesn't taste so good, then why should I pay for it? Oh, it's so difficult to get access to it. All these reasons, and some may say excuses, but I use the word reasons, what people bring about the cultural and other behavioral factors, they are extremely conditional if the household has to pay for it, or if they are paying some nominal amount for it. Otherwise, it really is not a big factor in the transition process. So let's keep that in mind as I kind of try to take you through the pathway that we believe can be useful to move towards primary use of cooking. Before I go there, I think because there has been a lot of discussion around PMUI, I think it's important for us to pause and understand how significant PMUI has been in this domain. Now I can throw you, of course, a bunch of numbers. You will see that before, almost 56% households were using solid fuels as the primary cooking fuel, more than majority. Now it's just about 40%. And two different large surveys have kind of come to this, that still about 4 out of 10 households are using using solid fuels either as primary or as exclusive fuels in their homes. We are also seeing that currently the average consumption, national consumption, is about 81 kgs. If you think of just PMU consumers, the data is not available, but I would say it will be somewhere in the 40 to 50 kgs per year. Our ideal goal, if we are really looking at exclusive LPG use, will be around 110 kgs. Again, a far-fetched goal, but it's good to keep that in mind. The other thing that I want to talk about is, okay, we have PMUI and we see the impact. So you can always pick up a 2016 data, and you can pick up 2023, 24 data, and you can say, okay, we are seeing that PMUI coverage, PMU has helped in 43% more coverage. We are seeing PMUI is helping in terms of reducing the PM 2.5 almost 62%. But one thing that we did, and this is still a kind of a research which has not yet been published, is that if we think of the business as usual condition, where if the PMU was not there, where we would have been today, what we see is we would have been in a far worse condition than what we are today. So we should really be thankful to PMUI in terms of ensuring that at least some amount of the load of PM 2.5 is not there, and that is because of a large grand scale project like PMUI. I have stolen this slide from Roshan. Thankfully, he has allowed me to do so as a collaborator. So the one point which I really want you to take away from this thing is that we have to make LPG affordable for the poor, and we are really talking about the bottom of the pyramid. And we should never forget this sitting in this glitzy hall that the target beneficiary is extremely poor with highly competing demands for the scarce resources that they have. And often the woman who is doing the cooking is not often the main decision maker for the purchase. So there's a strong gender dynamics inside it as well. So how do we make it affordable? And I think one of the ways we can think about is not to be the Puritan and say, oh, we should not support fossil fuels. Yes, LPG is a fossil fuel, but as research has shown, and this is multiple studies from different research groups around the world has shown, if you are transitioning from unsustainably harvested firewood to LPG, you have net climate benefits. So the carbon credit market needs to accept, acknowledge, and do its best to support the LPG transition, and at very conservative values we believe that at the prices that they are today, about 150 rupees per cylinder can be received as subsidy, which is not coming from the government, the traditional or the CSR funds, but from carbon credit market. And I think it's a fair ask if we really want to push towards cleaner cooking fuel, if we really care about this enough. And then the question comes in that how do we make LPG affordable? And I think it's important for me to kind of show you some numbers so that you have a sense of what we are talking about. And let's think about it from the perspective of the woman who is there and who has to take this decision of whether they want to purchase it or not. And one number that I have put in there is rupees 100. At the bottom of the pyramid, that is the number that we have thought is a reasonable number. We are not talking about giving something free of cost at a large scale, but a number which can be afforded even by the bottom 30% of the population. And most of the PMU customers, the PMU beneficiaries are not just economically marginalized but also socially marginalized. What we see is that if today the cost of LPG is about 950 rupees at a market price, the government has already made it up to about rupees 500 rupees. If the user contribution is about another 100 rupees or so, we are having this shortfall of another 300 odd rupees. If this money can come in, and you say, okay, 300 for one household is not a big deal, but it is a big deal if you think of the national. So while we have an actual bullet, we'll not call it silver bullet, platinum bullet, given it's an expensive choice, but we actually have an option of solving the household pollution fairly well because we can get this done. The technology is there, the supply chain is there, the people's demand is there. All we need to do is make it affordable. And this is the kind of the number. We need about less than 0.5% of the government of India's overall expenditure. If we can get that, the problem is solved. At least 25% of the household air pollution, of the 25% of India's ambient air quality problem will be solved by just investing 0.5% of India's budget. The other thing is, if we can't go there as an interim step, again, I am very much in favor of incrementally moving the needle. At least we can start with some of the vulnerable target groups. One of them is going for pregnant women or women with with children of less than 5 years, or go to people with compounding occupational risk, people who already entire day they are getting exposed to high levels of PM and coming back home and cooking with LPG. So, so if we talk, and Asar, one of our colleagues, they have done a great study recently in Nagpur where they kind of did this with waste workers, sewage workers, construction workers, and it's really a serious plight that we need to focus upon. This is my last slide, so I'm not even looking at Swagat. It's like, I think it's the last session, the last slide. I think I just want to come up with a kind of a call up to action here. It is that we need to really talk more about air pollution. It is frankly kind of the orphan in this entire air quality space, at least in India. There are several sessions, conferences where hardly air pollution is talked about, household air pollution in passing. We really need to change that, and it's up to all of us to do that, kind of push to mainstream the challenges around household air pollution. And the reason why we are focusing on LP subsidy, and this is something which is valid for any any technology, any solution that you can propose, it has to be technologically feasible, it has to be judicially tenable, it has to be politically doable, and it has to be financially viable. And we believe, at least I believe, it is a kind of a financially viable option. The second thing is we need to mainstream air household pollution in a national conversation, because we have to understand in a developing country, we are struggling with several competing demands on health, education, defense, development, infrastructure. So we need to really kind of, make mainstream household air pollution. When you write your media op-eds, when you speak with people, please take this forward. And the last is that we really need to talk about we talk about a national clean air program, but it's very much focused on urban-centric problems and urban-centric data collection. We really need to expand and get more data from rural India as well. Thank you.
Thanks, Abhishek, and thanks for giving the nirvana solution and the call for action. So, a nice way to sum up the discussion in this session. We have our two panelists online. Sorry? Yeah. No, but we have our two panelists online. So, let us take one or two questions from the audience, and I'd ask then our panelists to respond. So while raising the question, also let us know to whom, which panelist it's directed. Anyone?
I can go, actually. So so I just said that we close the session at 4, but since Dr. Kalpana and Abhishek are both here, and they have made a fantastic case for action on clean cooking, or at least, cleaner cooking, LPG. So Abhishek, you mentioned 10,000, how much? 12,000 crore rupees for 10 crore households per year, right? And number one, is that that's the current PMUY beneficiaries, right? Not all of them. And so what would be the total amount for that, potential PMUY beneficiaries? And Dr. Kalpana, for you, do you have estimates of what would be the health benefits of such a massive intervention, and how many lives would be saved each year? Have you ever done that calculation? You probably have, just
Abhishek, do you want to go first?
So I think out of the 30 crore, we have about LPG beneficiaries in India. We have focused on the 10 crore of PMUY consumers, and the thing is that for the others, the urban India, even in some of the urban slums, PNG is going to come up in a big way. So if we just focus on LPG, I think 10 crore is kind of the large number that you're looking at, the universe of beneficiaries who will need the support. And out of that, of course, there will be another, within that 10 crore, there will be 2 to 3 crores, which are like really priority kind of sectors, when we can talk about them. Thank you.
Kalpana?
Yeah, that is the estimate we have in terms of lives saved, of course, comes from the GPD project, and therefore, it is not the one that's the most favorite number to be talked about in terms of getting people to buy it, because and that number is about 1 million deaths and about 27 million DALIs for the latest round of GPD, and it's more or less the same as ambient air pollution, slightly more than ambient air pollution this time that I alluded to yesterday. But the only caveat that we have for the GPD estimates is that it is premised out of an exposure response function that does not discriminate by source. And therefore, we assume that the shape of the relationship is similar across other ambient sources of air pollution, where most of the evidence lies, as compared to household air pollution for mortality. I'm not talking about morbidity or other non-mortality related outcomes, because what the GBD does is take data where the GBD has some very specific requirements for a health endpoint to be included. It has to be available, across multiple countries, and it has to be. It should be possible to model it wherever the data is not available across other countries. So, given that conditionality, there are some uncertainties around how people perceive the mortality estimates. But that being said, it is the same deal for all the other risk factors also. So particulate matter is not being held to a different condition compared to low systolic blood pressure or salt. So if you buy the GBD results for other studies, we have to sort of. So anyway, all I'm saying is a very large number, and it is not any less than ambient air pollution. And so if you're really looking at overall strength of association for health effects and mortality, and I think Samya also mentioned yesterday, the average life expectancy in some states saved can be as high as 5.3 years, and the lowest estimate has been 1.9 years globally. So we have estimates of life expectancy saved as well as deaths that can be averted by this transition.
If I may just add, it's 1 death per minute for Indian conditions. So every minute, 1 death is attributed to household air pollution. Yeah, thank you.
So thanks very much, and I'd like to thank all the 4 speakers for their excellent presentations. And if we try to find a link between the previous session on NCAP 2.0 and this session, I think clearly the recommendation is on the Nirvana solution, the move towards LPG and the associated, benefits which we have both in terms of air pollution and climate change. So household indoor air pollution, I think, deserves much more attention, much more sort of awareness, and also in conferences, session which is not the last one but probably in the beginning. So thanks very much to all the speakers for their contributions. Thank you.
Thank you. I would now like to invite Ms. Anita to present gifts to our moderator and speakers as a token of appreciation.